In terms of how today's seminar is planned, we've scheduled in time for questions, so please, for the main presentation, if you can keep your mics off. We'll then open up questions at the end, and you can also use the chat box. If you feel you have a burning question during the presentation, use the chat box and we'll try and get to it to the end, or one of us might be able to get to it as we go through. For those that don't know who I am, I'm Jennifer Ferreira, and I'm a research fellow here at Coventry University in the Centre for Business in Society. One of my research areas is around the coffee and coffee shop industries, and in particular, I've been really interested in and written a few things about the role of coffee shops, in particular in different places in societies, and the role they play in creating communities. So I've been really excited to work with the Chatty Cafe Scheme, where cafes and coffee shops play a really important role in tackling loneliness and social isolation. And the Chatty Cafe Scheme is actually about much more than cafes, as you'll hear about today. But I've been working with the scheme to explore the impact of their services on social isolation and loneliness in the UK in particular. And I'm really fortunate today to be joined by Abigail Murray, who's from the Chatty Cafe Scheme. And she's first going to talk to you to explain a bit about how the scheme came to be. So just to give you an overview of what we're hoping to cover in the session today. First, Abigail will give an overview of the Chatty Cafe Scheme, and then I'll move on to provide a bit more about the context for the research project we did, explore a little bit about loneliness and isolation in the UK, and I'll talk about the research findings and some of the implications of that, and then hopefully there'll be some time for questions at the end, should anything come up. So I'm really happy to introduce you to Abigail, who's next going to take over.
Thank you, Jenny, and welcome everybody, and thank you so much for being here and for giving your time to attend today. So as Jenny mentioned, my name's Abby Murray and I'm the operations manager at the Chatty Cafe Scheme. So I'm just going to explain how the Chatty Cafe Scheme started, our services and our plans for the future, and then I'll hand over to Jenny. But firstly, I'd just like to acknowledge the National Lottery and Tudor Trust, who have actually helped fund this project, which has very much enabled the Chatty Cafe Scheme to grow and scale up and to conduct this research with Coventry University. And without them, arguably, none of this would be happening. So, we're very grateful for their support. So how it started. So this might be a recap for some people in this meeting, but for anyone who isn't aware, the Chatty Cafe Scheme, it came about when our founder, a lady called Alex Hoskin, who hopefully you'll be able to see in the picture on this slide, she recently become a new mum, and it dawned on her that she could have a number of days where she would get out of the house, but actually sometimes not speak to another adult for quite a long time. And it was actually when she became a new mum that she experienced herself feelings of loneliness and social isolation. And it was actually when she was walking around Oldham, where she lives, that she went into a cafe and she looked around and she just noticed that there were a number of people sat at different tables on their own, looking a bit glum. And it occurred to her, what if places like cafes designated a table as to what we call a chatter and natter table, and just really created a space where if people wanted to get together and chat, they could. And it was really from there that this idea grew about, encouraging cafes to designate these chatter and natter spaces. And it was really about, she wasn't necessarily thinking that people would use these tables and make like lifelong friendships. She just really recognized that even these small interactions can actually help somebody go from feeling a little maybe invisible to visible. And it was just about, trying to create these opportunities for conversation and interaction. So I'll just run through our services now. So Jenny, we can just switch slides, please. So back in 2017, when Alex came up with this idea, she approached a few cafes in Oldham and just started to get this concept off the ground. And it was in 2019 that we actually registered the Chatty Cafe as a non-profit organisation. And we now actually offer 3 services, all designed to try to tackle loneliness. So our first service is what I just referred to, where we encourage venues to designate tables as what we call chatter and natter tables by using this yellow sign. which hopefully you can see on this slide. And when I say we encourage venues, it's mainly cafes, but it could also be pubs, it could be cafes in libraries, community centres. And what we do, we train local people to give their time, maybe 1 to 2 hours a week, to actually go in and host the chatter and natter tables, and just act as a really friendly space to welcome people, if they would like to get together and chat. But we also run a telephone friendship service where we support people over 18 who are experiencing loneliness, who could benefit from a weekly phone call. And we have some wonderful, wonderful volunteers who are helping to make those calls every week. And our third service is we have, we host online chatty cafes, and that's where people can meet on Zoom in more of a group setting, again, simply to chat. And for all our services, I think it's important to get across this point that there's never like a topic or set agenda to these interactions. It's just all about trying to facilitate opportunities for conversation, with an aim to improve a person's well-being, and of course to tackle loneliness. So Jenny, if I can just ask you to switch to the next slide, thank you. So this is a bit about our vision for the future. So I wanted to include this slide just to show really that there is a framework and plan for how we're really seeking to continue to scale up and grow the Chatty Cafe Scheme services over the next 1 to 3 years. So what we have here, I won't talk through this slide word for word, but it's just to highlight really that as part of our strategic business plan, we have 4 key priorities. And under these 4 key priorities on this slide, we have like a series of operational milestones and work streams, which are all kind of helping us point towards scaling up our services and helping more and more people who are experiencing isolation and loneliness. And I just wanted to call out this last priority, which is about monitoring the difference we are making to people's lives. So this is a really important area for us, as we're really aiming to try to, as much as possible, kind of measure the impact of our services. And that was really the key question we put to Coventry University when we approached this research work with them a couple of years ago now. So this has been, this research project has been running for 2 years. And the key question was very much to Coventry, to what extent are the Chatty Cafe Scheme services helping to reduce loneliness and social isolation in England? So on that note, I'll now, if it's okay, Jenny, pass over to you to share the findings from that research.
Yeah,
okay?
Wonderful. Yeah, thank you. I think that gives a really good overview for those that are, perhaps less familiar with what the services are and what you do, and your vision for where you go. So that's great. Thank you. So just to give you a bit of a background before I launch into kind of the findings of research about the reasons why I was particularly interested in working on the research that looks at the impact of these kind of services, because I've been researching for some years about the different roles that cafes and coffee shops can have in society. I've written, various pieces about how they can play multiple roles in different places. A particular role is the space of community creation. For some people, they're just places to eat and drink, but I've tried to highlight they can be much more than this, and they can have a real impact on people's lives. They're places of sociability. They're places that have a possibility for people to generate these meaningful encounters. And that is exactly what happens through the chatter and natter tables and through the other services in different ways. And obviously the Chatty Cafe Scheme goes beyond the coffee shop tables in different ways, but the fundamental idea of cafes being places to get people talking was really interesting. And if we take a moment just to think about the experience of loneliness, we were just mentioning with someone in the room just before we started, loneliness, it's an experience that is, it's trying to address this is needed in a lot of places. Loneliness is experienced in various degrees across the country. It's been made a lot worse by COVID-19. The cost of living crisis, all these things are making this issue worse for a lot of people. If you can look at the statistics from the Office for National Statistics, the levels, have increased since 2020. And there are various different figures about how many people experience loneliness. Some estimates are it's around 45% of adults, which is around, 25 million people in the UK. So this affects a lot of people. people. It's a national issue, however you measure it. So, I mean, in this map, you can see the variation of the percentage of people who feel lonely often or always. You know, the darker blue areas show the higher percentage, but however you look at it, it's an issue that affects a large proportion of society, which is why we need schemes like this that try to allow access points to anyone in the country to try and get support. One other thing, just before we move on, it's important to consider some definitions. We've been using the terms, loneliness and social isolation a lot already. Loneliness is discussed in conjunction with social isolation a lot of the time. And while they're often interlinked, it's important to distinguish between the two a little bit. Social isolation is recognized as an objective state in terms of how much social contact somebody has, while loneliness is more of a subjective experience. But there are lots of different definitions in the literature, and this is two that I think just help differentiate it a little bit. These definitions are from a paper and the references at the end of these slides if you want to look at those in more detail, but I find them quite useful to keep in mind. These concepts are related, and while social isolation can lead to loneliness, and loneliness can, can lead to isolation, it's possible to experience both at the same time and at different extents. You may have periods in your life where you feel one or the other or both, but it's important just to kind of bear these things in mind. Anyone can experience social isolation and loneliness, and social isolation is more commonly affected, it's more commonly thought to affect older people when you look at some of the literature, but it really is anybody. And these are some of the risk factors that have been highlighted that can lead to, greater loneliness and isolation. I mean, this was from a report, and it was just, towards the end of COVID-19 sort of lockdown. So it highlighted how the COVID-19 pandemic made things a lot worse, but they show just kind of the range of factors that can lead to experiences of loneliness or isolation. Now, it's really interesting. There's been significant attention from policymakers recognizing that these issues around loneliness and social isolation are key issues affecting modern society here in the UK. I mean, arguably other countries too, but in terms of UK government policy, they recognized it. The government established the Tackling Loneliness Plan, and that sought to improve the evidence base on loneliness and also recognise that it cannot be government alone that tackles these issues, and that the best way to address loneliness is through partnerships, and that actually what you need is a whole society approach, and that it requires support and actions from a wide range of organisations, such as the ones like the Chatty Cafe. And then there's been a more recent report from the DCMS where they highlight lots of suggestions about particular interventions that can help reduce loneliness and social isolation and information. Now, this can be anything from just signposting services, support for individuals, group central interventions, wider community engagement. There's a whole, selection of different interventions. But what's really interesting is they highlight in particular the really important role of group settings as a pretext for social contact, and also the importance of community-focused connections, which is exactly what the Chatty Cafe Scheme does. So it's literally doing what the government says that we need across the country. And as you heard earlier from Abigail, the scheme was established as a way to try and tackle these issues. And since it's been established, it's grown significantly from just, one chatter and natter table to a network of hundreds of different venues, as well as the online services. And you can see here from the table, the numbers grew significantly. Obviously, there was a decline because of the pandemic, and we had lockdowns and everyone was shut. Things have grown again consistently, and we're still seeing lots of different venues joining up on a weekly basis, lots of people getting involved as volunteers. And they've had some really high profile kind of involvement with TV campaigns and things like that. So the ITV Million Minutes campaign for led to lots of volunteers getting involved, which is great. Now, I'll talk a little bit more about the research project and the outcomes in a few seconds, but I think it's really important to say that the Chatty Cafe Scheme had a clear framework about what they wanted to do with the scheme, and they had what they call a theory of change model, and they had a series of outcomes that they were working towards. And this was really helpful in terms of what we were looking at. So we did a research project to try to look at to what extent are they achieving these things. So they wanted to, find evidence that participating in their services reduced people's social isolation and improved their social, mental, physical health. They wanted evidence to try and find evidence that they're reaching different parts of England where social isolation is prevalent, evidence that they're participating in their services increased social mobility, evidence that people of all demographics can access it. Evidence of improved confidence and interaction by using these services. Evidence of improved mental health and well-being. Evidence of chatter and natter table being, an option and expectation of the public. Evidence that improving social isolation improves public health and reduces demand on public health services. And also, try and find evidence the public are becoming more aware of the social isolation. Now, this is a really simplified version of the whole theory of change model that they have. And if you're interested in this, the full version is in the report. But it gives you kind of key things to show, how they were having an impact on people's lives. And arguably they achieved all these outcomes to varying different degrees. They have achieved all these different things over the last few years. So the research was trying to work out, gain evidence for all those different outcomes and see how they were working towards these things and how they were having an impact on people's lives. And it had two stages. There may be some people in the room that came to a seminar last year where we presented some initial findings from a basic survey that we did of beneficiaries, volunteers, venues, and the public to try and just gauge a broad overview of how people felt about these things and how it's having an impact. And then what I've done over the year since that, year and a bit since that, is done just over 100 interviews following on from the findings of the survey, and also a much larger additional survey to go with it to try and find out how all these different stakeholders feel about the Chatty Cafe scheme, what kind of impact it's having on them, their venue, and also we did still include the survey of the public to try and catch the views of the people that aren't involved and why they're not involved. And there's no way I'm going to be able to get through all the the intricacies of the findings in this presentation, but lots of it is in the report, and if you're interested, I'll put the link up at the end for you to have a look at that. But just to give you kind of a broad overview of the things we found. So for the beneficiaries of the chatter and natter tables, there was definitely evidence that people benefited from sitting at these tables. For some people, it was definitely a planned activity, while others, it might have been a more spontaneous thing. Around 40% of people said that they would sit at these tables every time they went to a cafe. About 6% said it was never really planned. But then it depends a little bit on how they, which cafe they were going to, and whether it's one of the cafes that has a designated time for a chatter and natter table. Because some venues choose to do that model, particularly if they have a volunteer host involved. They may have a couple of hours a week or a few slots a week where there is a designated table and a volunteer there, which people are perhaps more likely to go to than just going to a table that has a sign there all week. So how the tables are used varies a little bit. Respondents were asked to indicate reasons for sitting at a chatter and natter table. And as you can see here, the most common response was that they like to chat to new people. But importantly, 96% of people felt that it helped to meet new people they like to chat to. Nearly everybody said that it made them feel happier, it made them feel less lonely and socially isolated, which is, the core aim of what they're trying to do with these services. Of these people, the majority highlighted that they felt lonely or isolated to varying degrees in the first place, and this really helped. But lots of people also suggested it made them feel more confident in joining other things too. This was kind of a stepping stone to then join other groups, particularly if they met other people at those tables that were doing other things that they were interested in. But essentially, it can create a network of support for people that way. It was generally felt that being involved with the scheme had a strong or positively strong impact on their mental health. And this is really important because that is one of the core objectives of the scheme. 96% said being involved with the scheme made them feel less lonely. 95% said that it made them feel less isolated. And that's really important. And while the survey information is useful in the evaluation, provides the kind of evidence that we need, it was talking to people that you really got to understand what the impact meant for their lives. It meant people had the opportunity to make that connection, something positive in their day. And everyone I spoke to was keen to continue their involvement with the tables in the future one way or another. Although a slightly more recent addition to the Chatty Cafe scheme, the telephone friendship service has been a really important part of their operations. Relationships with social prescribers in a number of areas of the UK has meant people who are experiencing social isolation or loneliness have been able to access someone to talk to. They perhaps might not be able to get out or don't feel comfortable in certain, going into a cafe to do those kind of scenarios. So it gives another access point for people with different needs. The most prominent reason people identified needing these calls was liking to chat to new people, but all the telephone friendship service respondents highlighted it made them feel happier and brighten their day. And again, I can't really get it across in these kind of slides. It's the quotes from the research that really kind of demonstrate what kind of impact that had on people's day and how it brightened their lives a bit. But they all said it helped them feel less lonely, less isolated, and it generally had a positive impact. Many people talked about how being involved in the cafe had improved their social and physical and mental health. One of the outcomes of the theory of change was about needing less services, and some did indicate that they felt that they didn't necessarily need to access as many services as they perhaps would usually. For a lot of the telephone beneficiaries, phone calls could be part of a package of various mental health services they may be accessing. So they may have been referred for the calls, but there was an overall recognition that these calls were helping them. They didn't perhaps need as much help in other areas that they might have done without them. People talked about how their phone calls improved their confidence in talking to other people, and in joining other groups, and that could have been other groups online or in person, and other ways to contact people. And ultimately, everybody said that engaging these services made them feel less lonely and less isolated. And this was a consistent message a lot, from respondents across the services. Again, there's another quote here, but it's typical for respondents to tell me how much they look forward to the call. And I'm not sure if there are any telephone volunteers on the call today, but there were so many people that I talked to that tried to express what a difference those volunteers made to their lives, and it's really important. And there are lots more quotes in the report, and they help get the idea across in a bit more detail. So then we have the virtual Chatty Cafe Zoom sessions. They were the other format of services that Abigail mentioned, and they emerged again as a result of the pandemic. They're group sessions with the volunteer hosting that. Again, the prominent reason for people highlighted for needing these sessions was that they like to chat to new people. Some people highlighted they joined other communities as a result of attending the online sessions. And this could just be online, forums and communities. It didn't necessarily mean going out of the house, but just other points of connection. They all felt it brightened their day and made them feel happier, and said it made them feel less isolated and lonely. 97% said it made them feel less lonely. 98% said it made them feel less isolated. For a lot of people, this was a great option if they can't get out of the house. And lots of people talked about how they developed an instant community of people on their phone or on their computer, even if it is just for a short space of time in that day, in that week. Now, the venues that host the chatter and natter tables, the physical chatter and natter tables, are a vital part of the scheme. And while this research wanted to understand the impact of the services on the beneficiaries, we felt it was really important to understand how the venues viewed their participation and any suggestions we can, have in terms of future operations. They were asked about how often they allocated chatter and natter tables, recognizing it might not be feasible to do things all the time. I think it was about 64% said they allocated a table every day, and reasons, some venues take a different approach. Some venues like the idea of having consistent table there all the time so people know they can just come and sit whenever they want. Others take a different approach where they would have an allocated time slot and a volunteer involved. And some of the more successful chatter and natter tables have used this model where they have designated times and a volunteer. And depending how proactive that volunteer is in advertising those sessions, it can be really successful. And while some venues, the Chatty Cafe was kind of the only community group that operated on the premises, lots of these places had community groups in their space at different points. And it really demonstrated some of the research I've done in the past that these cafes can really be spaces of community if they're given the opportunity. Importantly, the majority of venues felt that the chatter and natter tables were an important part of their local community, and they felt really proud to be a part of that community spirit that they were involved in. The volunteers are, again, a fundamental part of the Chatty Cafe scheme, whether this is sitting at a chatter and natter table, helping to kickstart conversations, or as a telephone volunteer, it's a fundamental part of how the Chatty Cafe scheme operates. And we talked to volunteers about, how they found out about the scheme, how they felt about, how they got involved. Quite a lot of people got involved through, they found out about it through external advertising. Lots of people got involved because they saw it on the TV, on ITV. And, whenever you talk to people about the scheme, they're like, yeah, well, we heard it was such a good idea. We wanted to get involved. And then there are also some volunteers who used to be beneficiaries too. So there's kind of that idea, the recognition that it was really helpful. So they wanted to get involved. The motivations for becoming a volunteer were quite varied. For some people, they just like talking to people. Some wanted to help. Some people wanted to feel more connected. Some people wanted to use their time to do something positive. Contribute to society, and also recognition that can contribute to their own well-being as well. And that's something we're really aware of, is that the volunteers themselves are engaging in these services and can have a potential benefit for themselves as well. So while the research we did obviously wants to gain the insights of the impact the scheme is having on people already involved, felt it was important to try and gauge the views from the wider public. So there was an outcome in the theory of change model that related to expectations from the public. So we tried to understand views from the people who were perhaps not aware of the scheme, or those that didn't feel they wanted to use their service, and understand why. Most of the people had heard of the scheme. Some people didn't know necessarily that it had different aspects to it, but they'd heard of the Chatty Cafe Scheme. They'd perhaps seen it in a coffee shop somewhere. And the main method people had found out about the scheme was from signs in a cafe, although wider advertising and social media had reached quite a few people too. And social media was one of the other sort of main important channels that people had heard about the scheme. People were asked about the extent of social isolation and loneliness in the UK. And it was really interesting because everybody kind of underestimated the level of the amount of people that were experiencing these things. I mean, people said, oh, it's probably a couple of million, but when you talk to them and say, well, it's probably about 45% of adults in various different degrees, they're quite shocked. So it shows there is still, not huge awareness for everybody about the extent of why these services are needed. And that's something that's important to change. So the need for these services, this research showed that the need for these services is clear. The evaluation demonstrated that there are different access points for the beneficiaries, which allows people with different needs to interact with these services in different ways. Generally, there was overall consistent positive response from people who've been involved across all the different services, as well as the volunteers and the venues. I mean, it was recognised that for some people, the benefits were more clear because they've been involved for longer periods of time. Some of the people, particularly some of the volunteers I talked to, hadn't necessarily been involved as long, so they hadn't got the kind of the longer term perspective. But generally, there was an overall agreement that what the Chatty Cafe Scheme was doing was having a really positive impact on people's lives across the country, which is great because it's exactly what we demonstrate to do. It was clear that those people that had involvement with the scheme, it had a positive impact. But there were also some reflections on how it could be improved, and I'll talk through a few of those in a minute. And I know the Chatty Cafe Scheme is already working on some of those and making some changes. But it's really important, I think, just before we move on to those recommendations, to kind of highlight the key successes. So, within a short space of time, they've, post-pandemic managed to really increase the number of chatter and table venues again, and that's consistently increasing. So they've got the increased presence of the organisation across the country and in lots of different types of venues too. The diversification of the services has allowed those different access points, which I've mentioned already, so people that perhaps can't get out and access the tables. It's based on a relatively simple concept. So the idea of just being able to talk to someone to improve their well-being, which means there are low barriers to access. There's no, if you don't have a phone, you can go to a cafe. If you have a phone, you can access the Zoom services, those kind of things. There's low barriers to access, which is great. The scale of the volunteer network has expanded significantly, and this is really impressive given the time scale. It's great to see that there's benefits for the volunteers as well as the beneficiaries. Loads of volunteers cited their satisfaction and their own improved well-being by being involved. And that the volunteer table host has been a really important factor in success for a lot of the Chatty Cafe tables. So having these people present in venues, being involved in getting those communities kick-started has been great. And then there are a few sort of recommendations. I mean, there was loads of positive findings. And again, I'll point you towards the report at the end. It's got loads more quotes which talk about all the kind of really key positive things that came out of it. But there were some suggestions about different things that they could do to improve their services. One of the main things was just about availability and access. So more tables, more calls, more volunteers, more telephone calls. But that's just the nature of scaling things up. And obviously there'll be capacity issues to do that. But, if lots of venues continue to get involved, then that will naturally address that. But then it would depend on, the volunteer networks for some of the other things to the extent that they can expand. Lots of the Chatty Cafe Scheme activities do have a reliance on the volunteers, and it's important that the volunteers are retained and that, because it requires quite a lot of training to onboard the volunteers, and it's important that they remain active within the scheme and they don't just kind of disappear after a while. So it's important that the role and the expectations of the volunteers are kind of set out at the beginning. And I know I've talked with Abigail about this, and also about how some of them feel that perhaps might need more training in certain areas or perhaps less training in certain areas, because much like the beneficiaries of the scheme will come from a wide variety of backgrounds, so the volunteers, some will be really experienced and have a background in health and social care, in which case they'll be much more experienced than someone that just wants to be involved and has no background. So there's potential to kind of tailor that as necessary. The other thing was quite a lot of people, both volunteers and beneficiaries, talked about the potential for trying to interact in other ways. So if you set up a community, from a table, is there other ways you can keep in touch with people that you meet there? But that can be something perhaps that's managed by the venue rather than the scheme itself. And then the other main thing that was the kind of key suggestion that everyone said was, we need to hear more about it. This is a fantastic scheme. Why are we not hearing about it in more places? And, you know, increasing social media presence, things like that. And I know the Chatty Cafe Scheme have already done a lot of work in terms of improving and increasing their presence on social media, which I think has had a real impact. You know, they have they show you where the new venues are, and lots of kind of links to various things around, you know, the key issues they're trying to address. And then the only other thing was around, it's kind of conflicting evidence about, you know, how to address the issue of stigma around loneliness and social isolation. This was something that came up in the seminar last year. You know, there were some people who responded to the research that said that the Chatty Cafe Scheme should be doing more to highlight about how it's reducing loneliness and social isolation through its activities. And then there were other people saying, well, we don't really want to highlight the fact that this is a loneliness thing, because then it will make us feel bad about feeling lonely in the first place. So there's a conflict there about how far you go forward in highlighting that you are addressing those things to the beneficiaries, even though they are your core aims. So there is a bit of a balance there to be had. But I know, you know, Chatty Cafe Scheme is working on some of these recommendations already, and I'm sure they're going to continue to have a real impact on people's lives. So these are some of the references that I've made in terms of the reports and some of the academic articles, and I can send these references to anyone who's interested, and we'll try and get the slides made available if people really want them. And then really it's just an opportunity now for people, if anyone's got any questions. You know, this is our contact details. I realize that, you know, trying to get through a couple of years worth of research in, you know, half an hour or so is not easy. So that's a whirlwind tour about what we've done. And there's a link here to the report that I produced with my colleague, Keijing, who's, I think, on the call as well. And really, I think it's an opportunity if anyone's got any questions or comments.
Yeah, thank you, Jenny.
I'll stop sharing just so I can see people. Right.
Yeah, thank you.
I was just looking
So did anyone have any questions? I think someone had their hand up before, but there's so many people's names on the screen. I'm trying to see who it was. What's the best way to handle this, Jenny? Do you want
to? I'm just trying to go through the chat to see if there's any questions there. Somebody's already really helpfully put the link to the report in the chat. Thank you. I mean, there's a comment there from somebody about how children are quite lonely too, and I absolutely recognise that, but I imagine there's only so much scope that an organisation can work on. You know, because Abby, I think the remit for the Chatty Cafe is 18 and above, isn't it?
It is, yeah, yes, very much so. I mean, there's a risk with Chatty Cafe, you can go off in so many different kind of tangents, and actually, yeah, that's very much our focus at the moment. I don't know, Jenny, were there any other questions on the chat that we need to pick up?
Just going through. So there's one from Marina. Hello from Flourish in Bath/Bristol. Hi. We've tried very hard to increase awareness of the scheme, but very rarely has anyone turned up. Do you have any recommendations to encourage more people to come?
Yeah, perfect. Jenny, are you on here? Did you want to answer that?
Other Jenny.
Other Jenny, sorry.
Yes, I mean, we can help you try and find a table host. That does really make a difference to the table. We can send you a poster to put up in your cafe, asking for if any customers want to volunteer to be the table host, or maybe there's even a member of staff that would be interested in doing it. We then ask them to apply through our website, and we guide them through all the training, and then they're good to go. And just having somebody there, even just 1 hour a week, and advertising that around the local town, maybe putting it in the local paper, sharing it on local Facebook groups. We do see the momentum start to build up, usually quite well. So, you know, do let me know if you want me to send you any information to help you get started with that.
Thank you, Jenny. There's another question here. Have you got any links with any large companies? If it's all right, I'll just reply to that. The answer is yes. We've got a partnership with Costa, and I've actually been working on, as colleague Jenny knows, some slides around corporate sponsorship, and we're really, really keen, if we can, to try and secure more. But as I'm sure you'll understand, it's not always an overnight thing, but we are very keen to increase that.
And lots of people, when I spoke to them, they'd seen the signs in Costa, and that was kind of how a lot of people had seen, and they heard about it, or they'd seen bits on the BBC News about links with Costa and things like that from previously.
Yeah, thank you. Another question is, how does social prescribing work? Are you happy? Shall I answer that?
Yeah, and is it Kirsty's helpfully put a link there to what social prescribing is, which is really helpful. But yeah, if you could just give a summary of how that works.
Oh, thanks, Kirsty. But yeah, I suppose a very simple overview is that social prescribers, or sometimes they're called link workers, often the term community connectors used, they are people who can refer people to sort of non-medical services like the Chatty Cafe. So an example might be if somebody goes into their doctors and says that they are experiencing loneliness, that the doctor could put them in touch with a social prescriber who could support that person to find out what activities are happening within their local area that they could be linked up with. I hope that's the right explanation, because I know we've got social prescribers on this call.
I think that's a good summary. I mean, it's
please do correct me if I'm wrong.
Yeah, and we've got a comment from a social prescriber saying that some clients find it hesitant to attend a cafe, much prefer to attend the telephone befriending call, often because of transport difficulties or anxiety in attending in person. Exactly, and I had lots of people tell me that they just wouldn't attend a cafe, they just wouldn't be able to. But they gave them that ability to still have that connection, which was great. Someone asked if you got any links with the warm welcome scheme. So someone from rural Dorset, they ran several sessions last winter and spring. So this idea of the warm schemes, do you have any links with those or not?
Yeah, so we're working with the West Northamptonshire Council, where they're looking at kind of converting what they identified as warm spaces, but now into more chatty cafes. So we have started to explore sort of how we could work with them. Can I just take a question off Jim? Because I can see you've had your hand up a few times, Jim. Did you have a question?
Sorry, I can't see the hands coming out. I'm just seeing the chat. Yeah.
Or you just have to unmute. There you go, Jim.
Okay. Yes. I'll start by saying that I'm a Chatty Cafe disciple. Having been a member of the Chatty Cafe Scheme in Leicester since February 2018, and listening to what's been said to date, from a personal point of view, I would say keep it simple. If you want the Chatty Cafe to get off the ground and be a success, my observation is keep it simple, keep the conversation light. In our cafe, which is now a community cafe, very well supported, and we have all types of community groups that come into the cafe that basically arrange their own meetings but feel comfortable in the operation that we run. We have 52 tables. We only have one which is set aside and signed as a Chatty Cafe table for 4 people, because there are people who just want to speak to one-on-one or two-on-one, and we find that other people come in and set their own tables up, and it's a nice way of doing it, and they talk to each other. So certainly to start with, and as I said, we've been going since 2018, that my view is keep it simple, because majority of people are just simple folk. They are suffering in some cases with loneliness, which was exaggerated by COVID. And now they've started to come out of themselves, and we find the Chatty Cafe table is an asset.
Thank you, Jim. And that's good. And I love your background.
I was going to say it's very appropriate. I should have had a background like that, really.
Yeah. Although it's freaking me out slightly because that's our old marketing, Jim. I'll have to send you some new ones. That's the blue one. Was there any other
Yeah, so there's a
questions?
few more questions. So I missed one. I'm really sorry, Caden, about the age range of the participants. So actually, we had a really good range of age range. So I mean, the survey went from 18 right up to 87. I did also interview someone. I think the youngest was 21, and the oldest would have been 95. So I mean, there is a slight skew towards older participants in the interview data, but there was evidence that there are lots, all the age groups were accessing the services, probably not to the same extent, but that's to a certain extent can be a feature of, working age groups might not be able to access the tables in certain times if they're in work. But that's why it's really important to have a wide range of places offering different time slots, because people being at work can still be lonely during the, so they need weekend, evening opportunities, those kind of things. And I know you've had like some sports centers and things sign up with chatty cafes and things like that. So there's other ways for people to access. But in terms of participants, we had a wide range from, just into young adults right up to the 90s, which was really encouraging. And I can see, sorry, is it Dorinda's got her hand up?
Yes, yes, I have. Sorry, thank you for that.
I'm just getting to your bit on your text there as well. Yeah, sorry about that.
So we, interestingly, I mean, I'm really, really very grateful for all your slides too and the information. Sorry, this is where I am currently in progress of having to paint and do stuff to get us open up in Falkirk. So I'm actually in Scotland, although we've got cafe hubs in England. Particularly grateful for all the research that you've done, because I've been aware for years that isolation and loneliness is the fundamental issue around so much that goes wrong in people's lives. And because we support a particular cohort, veterans of the armed forces, they are particularly isolated and lonely. And part of the job that we have is getting them integrated into society again, which we do through cafes on easy access point on the high street. So everything that you have said in here is really, really pertinent, and I think completely and utterly undervalued in society. I would also say undervalued by grant givers right the way across the board. Because human connection, which we so desperately need, particularly now as the world goes to ratchet, not to put too fine a point on it, is really, really important. And it does. And that old adage of a problem shared is a problem halved is so true. And I see it time and time again. I think that, and I completely concur with Jim about keeping it simple. It is simple. I think that you could belong to the Chatty Cafe Scheme without necessarily having a table set aside, and I think that's something that we'd love to join. We're also in Scotland and have it as an official thing. I don't badge the charity or other cafes on purpose, because that produces exclusion automatically. So the only thing we have on our doors is that dogs have to be kept on a lead. But which is really, really important. You'd be surprised also, and this is also something else to think about, you'd be surprised how many cafes will not allow dogs in, which for older people and particularly people who are highly anxious is really important. And again, we have everybody in our cafes, from children right the way through to sort of 100-year-old individuals. It's that whole mix thing. I just think you're doing an amazing job. The research, I'm afraid I'm going to be using for funding bids, because it's so important. And for building community, which is where we can change how things happen, having this facility is without doubt one of the most important things. And I just wish that councils and things would actually sit up and take a bit more notice of the amazing work that this does, because it starts the conversation, and through those conversations you end up with solutions, sometimes ones you're not expecting.
Thank you. I mean, hopefully this is kind of the point of the research as well, was just kind of to demonstrate the positive things that these can do, and that's why they should be funded, if they're given the opportunity.
Thank you. Thanks for that. And yes, just another hand I can see that's gone up. I can't see your name, sorry, on your Zoom account, but you might have to unmute yourself.
Is that better?
Yes, perfect.
Lovely, thank
you.
you. Yeah, is it possible to have some posters? And where I was thinking to put it, it tied in with somebody talking about, you know, the warm space. And I'm not plugging religion at all, but they do have warm spaces I'm down in the South Coast, down here, and predominantly I would say we're an older generation. I agree with the dogs. Our church allows dogs in as well as people, which I think is great. And we have quite a few cafes of the same. But I wondered if I put it in the back of the church, people who might not know about the system, you know, the Chatty Cafe thing, and might think, oh, do I really want to go and spend money and coffee and what have you? They'd see a benefit of doing that. So can I have any posters? And are you happy for me to put them in the back of churches? And I'm not evangelizing.
Yeah, yes, absolutely. I'll just need to, are you able just to send me your email address on a private message or something?
Yes.
So I can follow up with you
Yeah.
after.
How do I do this on? No, that says
I'm going to put my email address in the chat box, and if you can get in touch with me, and actually if anyone on that note wants to get in touch with me, please do.
Thank you, and I'll scribble it down and do it afterwards. And I thoroughly enjoyed this, and your report was fantastic. And I don't know how you managed to pile it all in the time, Jennifer.
Thank you. It's very difficult trying to get, there's so much in there, but I know, you know, really what I want to do is read out the quotes from the people, because that's what really, for me, you know, gets across the meaning of these things. You can give a pie chart and it says, you know, got a number, but if you read the quotes, it really shows what it meant to people, you know, doing these things. And so there's a comment from Holly who says, fabulous service, befriending calls gave some of our housebound clients lifeline to outside work. So thank you, from Holly, Age UK Oldham. There was a question about discounts at cafes, but I think that's something that's done by the cafe. That's not something that you deal with, is it, Abigail?
No, I mean, we have to recognise that the cafes are, you know, running as businesses. So unfortunately, you know, we can't ask them, you know, to provide free drinks. However, some of them do provide a bit of a discount for Chatty Cafe sessions, but it's absolutely on a kind of discretionary type basis.
Someone says, do you take, so Nikki says, do you take temporary volunteers such as maternity or sick leave with the hope of training another person up from a location to continue the facilitation after a person returns to work?
Yes, 100%.
Yep, great.
Yeah, absolutely.
So, I mean, anyone that wants to get involved is, you know, it may, you know, not everybody can do it for a long period of time, but if you've got someone that has a period of time that they can do it.
Yes, I don't know if you want to elaborate on that, Jenny, at all. Sorry, it's so annoying you both called Jenny. Jenny Vincent.
Jenny, yeah.
We've got some venues who have more than one volunteer, which is fantastic, that come through our volunteer application process. And it just means that if ever someone is poorly or away on holiday, or maybe in some cafes, someone will do, you know, every third week. It just helps share the load. And it's also great if two volunteers want to sit at the table at the same time. You know, it doesn't have to be just one volunteer sat at the table. So we would always encourage cafes to, you know, ask anyone interested in volunteering just to come through our website, the volunteer application link, and apply. And they can just volunteer when, you know, when they can.
Yeah.
Thank you. Just get through the comments. So someone's so Annika's asking, do you have any conversation prompts? So they've attended the Death Cafes in Costa, which is much less scary than it sounds, celebrating life and the end of life. I've heard of those. Which is a host, was a really great format, although conversations were quite deep. So yeah, do you have any conversation starters, like support for, I know you have like a plan for volunteers who want to set up a table. Do you provide like conversation starting points and cards within that? I think you do provide some materials.
Yeah, do you want me to answer?
Yeah.
We don't provide actual cards for conversation because we just think it's really, really important the conversation is organic and not planned. But we appreciate sometimes it's just nice to have some prompts for if the conversation just does, you know, go quiet. But we wouldn't we don't have anything actually on paper for that, we would just always say, maybe just think of a few things before your session starts that, you know, maybe current news, things that are happening, maybe there's something local that's going on, you know, a new building being built locally or a new supermarket about to open, just little ideas in your head. Maybe there's been, you know, a new program on TV that everybody's talking about, just little prompts like that. But I always say to volunteers, do not be afraid of that lulling conversation. It's normal. It's fine. And often if you let the conversation have that lull, somebody jumps in and starts a new conversation rather than the host doing it all the time.
Yeah, just to mention on that as well, we do have on the yellow chatter and natter table signs, there are some ideas for conversation starters on there as well.
Yeah, I think there's 3 on there.
Yeah, no,
So,
definitely.
there's a comment from Caden. Are there really no venues in Coventry? I'm just curious to get involved. There definitely used to be, because I've definitely sat at one. I know the Costa used to be involved. I'm not sure if there are any more in the city centre. And I know there used to be a couple slightly out, but I'll look into it. I mean, if there isn't, I'm pretty sure there used to be one down in the Transport Museum as well.
Yeah, embarrassingly, I don't know off the top of my head, but the best place is on our website, on our map.
I was just going to say because there's the website that has the map and all the, because
Yeah.
you've done an audit of those, haven't you? So they're the more
We're desperately trying to make it's actually a massive task to keep the information on that map up to date and accurate. So yeah, that's a thing that we're continuously working through. So the chances are, if there's nothing on there anymore in Coventry, it's because we're either struggling to get hold of the venue or the information just we don't feel is up to date. So we've taken it down.
Well, hopefully that will change and we can make sure Coventry's represented there. So definitely saying funding could be a challenge. You know, heard a comment about funding bids advice. And yeah, I mean, that's something that we've talked about before, isn't it? You know, the issue of funding is a real issue.
Yes, yeah, that is a constant issue, but yeah.
Jason suggesting posters in GP services could be fruitful, and I think that's definitely one of the places people suggest. You know, GP surgeries, hairdressers, anywhere where people might go and stop and sit for a minute that may be able to see a poster. It's useful. So I think we've got through all the questions in the chat, and I'm really sorry if I have missed. Please do say so, because I've been trying to scroll through and I may have missed anything, and I'm really sorry if I have. Or this session will finish in a few minutes, but there is a couple of minutes left in case anyone does have any questions.
Yeah. Did anyone else have anything to ask, like verbally? Sorry, Jennifer.
No, I was just going to say. Sorry, carry on.
Can I say something?
Yep.
Yeah, go for it.
If you're a volunteer, take a poetry book with you.
Okay.
Okay, well,
just to explain, Jim comes on our virtual chatty cafes sometimes and does read us a poem at the end of the session. So that's where that comes from.
Oh yeah, you were all like a bit confused. Okay, cool. Well, unless there's anything else, shall we
I think we'll wrap
there,
up. I mean, thank you. Yeah, thank you so much, everyone that's come to the session today. The link to the report is there. You've got our email addresses from the slides. And if do get in touch. Both of us are happy to continue the conversation.
Yeah, absolutely. And I will put the recording on our website as well. So as soon as I've got that. But just to reiterate what Jenny said, thank you so much for giving your time to be here today. And we appreciate it lots and lots. So thank you to everyone.
Great.
Okay.
Thank you.
Thank you.
Okay. Have a good afternoon. Take care. Bye.
Thank you. Bye. Thank you.
Right.